For years now, scientists and doctors have warned the public about the dangers of smoking and the harmful effects this behavior has on your body. Despite these warnings, the American Heart Association reports that smoking kills over 440,000 people in the United States each year. Based on these figures, it's not enough just to tell people that smoking is bad. So today we're going to take a closer look at the effects of smoking and tobacco use have on the body.
Not only does smoking have a huge negative impact on your lungs, it also impacts your other body systems. The Center for Disease Control reported that smoking impacts every single organ in the human body. According to betobaccofree.gov, smoking has been related to several autoimmune disorders, including Crohn's disease, rheumatoid arthritis, and type 2 diabetes. Smoking can damage your vision with connections to macular degeneration, optic nerve damage, and blindness. Classic respiratory issues related to smoking include chronic obstructive pulmonary disease, emphysema, chronic bronchitis, pneumonia, asthma, and tuberculosis. Smoking while pregnant can cause preterm birth, stillbirth, or ectopic pregnancy, and has been linked to erectile dysfunction in males. Finally, smoking can have fatal effects on the cardiovascular system. According to the American Heart Association, 1 in every 5 smoking-related deaths is caused by cardiovascular disease. Smoking has been linked to plaque buildup in the arteries, aneurysms, coronary heart disease, heart attack, peripheral arterial disease, and stroke. For the sake of time, we will focus on 4 negative effects that smoking has on the body, including arteriovascular insufficiency, ischemia, thrombus formation, and impotence.
Arteriovascular insufficiency is any condition that causes the slowing or stopping of the flow of blood through the arteries due to a buildup of plaque. As a result, the arteries become narrow and stiff. 2 of the disorders we highlighted as negative impacts of smoking can be categorized under arteriovascular insufficiency. The exposure to cigarette smoke increases the rate of fibrin formation and development of fibrin clot strength, which results in a thrombus. A thrombus is a blood clot that forms and remains in a vessel. Thrombi can get lodged in blood vessels, slowing or even stopping the flow of blood through these vessels, which then deprives the body tissues of oxygen. If a thrombus breaks away from its original location and travels through the cardiovascular system, it becomes an embolus. Emboli are extremely dangerous because they can become lodged in the heart or brain, causing oxygen deprivation and possibly tissue death, which can be fatal. Ischemia occurs when the blood flow to your heart is reduced so that the heart cannot receive enough oxygen. Similar to a thrombus, this reduced blood flow is usually due to a partial or complete blockage of an artery. Ischemia is associated with coronary artery disease and can cause a heart attack or a stroke.
Clearly, plaque buildup in the cardiovascular system can be a huge problem. Another issue that is associated with smoking is erectile dysfunction, also known as impotence. This relationship between erectile dysfunction and smokers is not a relationship that is well known to the public. Due to the high blood pressure and blockage in the arteries caused by smoking, smokers can experience impotence as blood cannot reach the necessary tissues, causing major circulatory problems. The penis is filled with a dense network of blood vessels. An erection begins in the brain. Some type of stimulus triggers chemical message to be fired off to the blood vessels within the penis. Following this, the arteries enter a relaxed state and they open up, letting an increased amount of blood flow into that area. Simultaneously, the veins close up, trapping the blood within the penis and causing the erection to be held. In a smoker, blockages in arteries decrease the circulatory system's efficiency. The penis is unable to receive the blood flow needed in order to get and keep the erection. Although this problem may seem small when compared to catastrophic events of smoking like coronary disease and increased blood pressure, it is an example of how no part of the body is safe from the effects of smoking. Research does indicate a strong correlation with the intensity of smoking and the severity of erectile dysfunction. This research also showed that erectile dysfunction symptoms were lessened in those who had quit smoking.
Just because you don't smoke, that does not mean that smoking does not affect you. According to the American Lung Association, there is no risk-free level of exposure to secondhand smoke. Secondhand smoke contains more than 7,000 dangerous chemicals. In recent years, the Center for Disease Control reported that more than 2.5 million adults passed away from deaths related to secondhand smoke. In adults who do not smoke, frequent exposure to secondhand smoke has been linked to coronary heart disease, stroke, and lung cancer. The effects of secondhand smoke can be even more dangerous for infants and children. Children exposed to secondhand smoke are more likely to experience frequent and severe asthma attacks, respiratory infections, ear infections, and sudden infant death syndrome. Clearly, smoking has huge negative impacts on the human body, especially the cardiovascular system. If you are a smoker, consider the irreparable damage you are doing to your body, as well as the harm you are causing to your friends and loved ones by exposing them to secondhand smoke.